person's health is affected by lots of different things. Not only access to healthcare clinics and providers, but also through their housing and the quality of food they eat and their jobs, their incomes, their education, all those things play a role.
What constitutes health is not just exercise and what we eat. We know that the determinants of health are our everyday lives. It's where we walk, our ability to go out and walk in safe places, our abilities to go out and have access to groceries.
Maybe the most valuable thing that any of us have is our health. It's hard to raise a family if you're not healthy. It's hard having children that aren't healthy. It's hard if you're caring for elderly persons who have health impairments.
You know, you may not necessarily think about a city as part of health, but the way a city is built and the way that a city is designed and where they put their resources can really have an influence on how well their citizens live.
Because without a safe place to live and somewhere stable to go home to, it's really hard to do well in other areas of your life, like school performance and attendance, or showing up to work on time. Things like that are really difficult if you don't have those basic building blocks.
So we all know people that have information but don't use it, right? So you can know, like, I should eat an apple, and that's great. And you can have all the information about why apple eating is good. But if you don't have access to apples or the money to pay for apples, or someone saying, you know, you should probably have apples instead of fries, like, then that disconnect still remains.
Some of the barriers to eating healthy is actually accessing it. And so that's one of the things that we've been discussing in the CHIP assessment.
District 1 is pretty diverse, and so we have people that are on the low socioeconomic ladder as well as some more affluent. And so having just a quality place to go and purchase groceries in our community is something we need.
It is so important to learn how to prepare nutritious foods. I think that is one of our biggest challenges and barriers. We're a fast food nation. And so one of the things that we are super excited about out at the Tulsa Farmers Market is we believe that nutritious food should be accessible to everyone in the community. It's great for the farmer, it's great for the local economy, it creates a healthier economy and community because of this.
We need to be looking at housing and health as a community problem, because it is a community problem. It's one thing to have healthy housing, it's another thing for it to be affordable.
We have issues with transportation. We live in Oklahoma, so if you don't have a car, you're kind of stuck in some cases. So we're looking at how we can use the community to help bridge some of those gaps.
The bike is an active form of transportation, so if we start to maybe change the culture to consider a bicycle as a form of transportation instead, to the market or the library or to school, we'd like to see that kind of change happen.
You know, having policies that promote having complete streets is really going to help people actually get to grocery stores or get to healthcare, get places where, to make those healthy choices.
One of the greatest challenges that we face is access to healthcare. So when we talk about access to healthcare, we're not just talking about making sure people have transportation, we're talking about making sure people have health insurance, and beyond that, we're talking about making sure that people know how to use those services.
Opening up a clinic or providing a service is a key first step, but it's only a first step. So it's oftentimes more than just saying, here's the service. It's building trust, especially in communities that have for years have been on the margins and have been left out. A lot of programs and a lot of policies and things like that. There's distrust there. You have to create the belief amongst the people you're trying to serve that you're actually there to help them. And the best way to do that is you have community participation in the development of a healthcare initiative.
Most of the people we work with are in poverty or have some sort of crisis happening. And many times health insurance is not at the top of the list.
Our project focuses on connection to coverage and connection to a medical home. We focus on meeting the client where they're at with whatever that situation is, helping them understand the importance of preventive care, the importance of going to a single clinic or a single doctor, when to go to the emergency room, when not to go to the emergency room. When you don't have coverage, it's difficult to have that medical home relationship because you cannot afford it.
If there are individuals in a poorer part of the town who have less access to care, or have less primary care, less insurance, oftentimes they'll not get care for a long time, which exacerbates healthcare problems, and then they'll go to an emergency room. There's cost that for their care affects the cost of everyone's care, because essentially everyone is involved in the healthcare system.
Right now, for the first time in public health and healthcare in general, we're looking at how do you break down some of these barriers to help people really make the changes that they need. We recognize that we can't keep doing the things that we've always done and expect different results. We have to start looking at the way education interfaces with health. We have to look at how the economy interfaces with health, how our living situations interface with health. We're navigating life together, and it's taking all of us looking at our piece and how it's connected to the whole in order to make a change.
The value of CHIP is that it's based on the recognition that healthcare outcomes require community effort to address.
So when we talk about the CHIP, when we talk about the health problems, when we talk about all of these issues, we're talking about how do we galvanize what we have in order to make things better.
We could not do this without the graciousness of our community partners. Something I'm super proud of is how many partners we have in this, and they transcend kind of the community.
So you have to have a collaboration of individuals and organizations from all those different aspects of a community to try to come together and build a system that generates good health. And it has to be a system, and the CHIP model is well suited for that.
Health is more than just what happens in a doctor's office. Health is really what happens in our community as a whole, and what kind of community do we want to have? Do we want to have a community where people are consistently struggling because of preventable things that we know we could do better? Or do we want to have a community where we're constantly looking forward, constantly striving to do better and to create a place where every citizen has the ability to get healthier?
It's going to take all of us, and it's going to take fresh ideas. It's going to take the people who've been in the trenches and know what's going to work and what's not going to work. It's going to take all of us working together.
In whatever capacity you can give back, and whatever that looks like, whether that means reading with a kid for 1 hour once a week, or making a donation to the food bank, whatever capacity you can give back, it will pay you back tenfold.
There's so many wonderful projects and programs here in the Tulsa area that we just want to get the word out and get everyone involved.
Everyone can be involved in the CHIP process, whether it's reaching out to other CHIP partners to get data about, writing a grant application, or if it's using resources to increase programming in your agency, or whether it's just being active in your own community. There's lots of things you can do to support health in your own community.
First of all, thank you. Thank you for everyone in spending their time and effort to come together and recognize that in order to improve health in a meaningful way in the Tulsa area, that it requires everyone to participate.
I'm hoping that with the new administration within the city of Tulsa, along with the philanthropic organizations and community leaders coming together to say, hey, let's get this done, that we'll be able to do that, and I have every hope that we can.